Should I check my IUD strings each month? The bottom line up front is no. Stick around and I'll tell you why. Many physicians still recommend that patients check their IUD strings themselves periodically, usually once a month after menses if they still have a period. The product inserts for all the IUDs currently on the market recommend this practice. For example, the insert from Mirena instructs physicians that, quote, she should be instructed on how to check after her menstrual period to make certain that the threads still protrude from the cervix, and caution not to pull on the threads and displace Mirena, end quote. One study performed in 2017 found that only half of women who were counseled to fill for their IUD strings were either able to or willing to. In other words, telling women to fill for the strings may decrease a woman's willingness to get an IUD for birth control in the first place. More importantly, since about half of women are unable to fill the strings even when they try, this piece of advice may cause them anxiety and to seek medical care when it isn't necessary. The idea behind filling for the string is to make sure that the device is still in place. Perhaps the IUD's fallen out or is perforated through or embedded into the uterus. When these products originally came to market, the companies made use of the FDA package insert instructions and this recommendation to deflect blame for expulsions and perforations onto the patient. This was, of course, to avoid lawsuits for pregnancies or other problems that resulted from the IUD falling out or otherwise displacing through the uterus. A more evidence-based source for a recommendation comes from the U.S. Selected Practice Recommendations for Contraceptive Use, which in 2016 made it clear that checking the IUD string isn't necessary. But while this advice might seem to look good in court to the people who make IUDs, it does little to actually help the patient, and in all likelihood only causes harm. Uterine perforations only occur at a rate of about 1 per 1,000 insertions. They happen at the time of insertion, as do partial perforations or embedding of a part of the IUD into the uterus. If there's a concern about this occurring, then an ultrasound is usually necessary anyway to figure it out. But a follow-up string check at the doctor's office at around a month after placement should catch almost all of the true perforations. As far as expulsions are concerned, these occur in only about 1 in 600 women, and almost all of those also happen in the first month, meaning that a 1-month string check would catch almost all of them. But even if they occur later, most women will still notice. Some will notice a change in bleeding or cramping, but most women will notice the device itself fall out. In fact, we think that around 99% of all expulsions are noticed by the woman when it happens. In other words, 60,000 women would have to do string checks on themselves for one woman to detect an expulsion of the IUD that she would not otherwise have known about. Some of those women will actually unintentionally pull their IUD out while trying to feel for it. That's doing more harm than good. But almost half of those women won't be able to fill the string to begin with, and if they follow the instructions to the letter, they'll present to their doctor's offices each month to get the IUD checked on. Yeah, that's as crazy as it sounds. Even in the original studies where the safety and efficacy of IUDs were assessed, patients were not required to check their IUD strings routinely, meaning that this practice is not required to achieve the excellent results that IUDs offer women. So stop checking your IUD strings and worrying for no reason. There's simply no scientific evidence to support this practice, and it may cause unnecessary anxiety and convince some women not to get otherwise excellent birth control in the first place.